Welcome to Disability Voices United, SDP Connect. My name is Christiana Morales. I am the Director of Self-Determination Program here. Judy Mark is also here with us today, and we have a great presentation coming up. We do have some announcements. Before we start, I wanted to make sure everybody knew that we have interpretation. Please go down to the globe at the bottom of your screen and click that and select your language. Even if you speak English, you need to select a language because if it is interpreted, you won't hear it. So everybody select a language. If you're on a cell phone, please go to the bottom of your phone and pick the 3 dots, select those dots, and then you'll see the interpretation languages. So we have a lot to talk about this week. SDP was a little busy. We were busy. So I'm going to start off with the very first thing that came out was a DDS directive on June 30th. It was about the 099 vendoring. So this was the independent facilitators needing to be vendored with the regional center in order to help with that transition part of the getting into self-determination program. They had a deadline of the end of June to get people in as vendors, and it was extended on June 30th. The directive extended it to the end of this year. They also had an enclosure just kind of for how independent facilitators should be billing. If you're a participant, you don't have to worry too much about this, but I know that the directive hasn't been posted on the—
Can you slow down, Christiana? Sure. I'm sorry, just for the interpreters. Thank you.
On the DDS website. So we are going to put the links in the chat so you can get the directive and the enclosure. And our second thing we wanted to talk about was the resource fair for North LA Regional Center. They're going to be having it on September 23rd. We don't have a flyer yet because we're just in the setting up process, but we are taking vendor signups. So if you're a vendor and you're interested in doing the September 23rd, North LA, it's the Santa Clarita office. We are going to put the link in the chat so you can sign up to become a vendor for that resource fair hosted by their self-determination program committee. So the next one was, we did want to mention that GT Independent had a meeting this morning. And so we attended it. We will be able to talk about it a little bit after our presentation. And our last announcement is just an update on 1147, and Judy's going to give you the update.
Hi, everybody. Thank you. So great to see you all. I know we're going to get a very large turnout today to hear about the evaluation of the self-determination program. Before we get started with our presentation, I wanted to just give you all an update because I know many of you have been following how things are going with the bill that Disability Voices United and Integrated Community Collaborative have co-sponsored. It's called AB 1147, or the Disability Equity and Accountability Act. The bill is doing well. We passed, as you know, through the Assembly last month, and we just this week passed out of 2 committees, both the Human Services Committee as well as the Judiciary Committee. And so we're pretty happy. Some parts of the bill have had to change over time. And so I'm hoping that you will all be here with us as we go through this. That the legislature is taking a 1-month break. And during this 1 month, we will be reaching out to those of you who are interested in helping us. And we will be meeting with lots of legislators to try to move this bill forward to passage. So we will keep you updated here at the SDP Connect. We know we have a lot of support here. So thank you all, and I'm going to hand it back to Christiana, and I want to make sure that we have all of our speakers as made co-hosts and everything before we get started.
Ed, are we ready? I'm going to do an introduction.
Sure. Would you like me to go first, Christiana, or would you like to do your introduction first?
Go first.
All right. Oh, sure thing.
Actually, before we get started, Ed, I'm sending
He's
you
already
a
removed,
very
Judy.
important private message. Could you
He's already removed.
Okay, thank you, dear.
Yep. Okay.
And so if anybody has received a private message, which many of you probably have, from this person named Jerome Santana, who came on our lap, we keep getting spammed here, guys. This is why we're taking a lot of things into under control here. So please do not click on the link of that private message. Just ignore that. This is a spammer, and thank you all.
Okay, folks, so just a reminder to our speakers, as well as to the people who might be asking questions later on, just a reminder to try and speak at a moderate pace for both our interpreters, as well as for the auto captioning software that we use to make this meeting more accessible. In addition, please avoid crosstalk. It makes it impossible for our interpreters to do their jobs, and it also stalls the auto captioner, so it makes the meeting inaccessible to anyone who's using that or who's using interpretation. So thank you so much. I appreciate that. And without further ado, I will kick it over to Christiana, who will be doing an introduction.
So I want to give a little background of what we're talking about today, so everybody kind of is caught up and knows what we're talking about today. So the statute required that a report be done within 5 years to kind of talk about to make sure that the self-determination program is furthering the principles of self-determination. If you're not sure what those principles are, they are respect, authority, support, confirmation, and I'm missing one. Freedom.
Responsibility.
How did I miss
Freedom, the most important one?
the very most important one? Oh my goodness. So this is the result of this report. And so we're going to be getting the input, and this went to the legislators on last Friday, I believe, right? The 31st, I think. And so we had talked about it previously about the as they were coming up with the surveys. And so a lot of you participated in it. And so I think you'll be really excited to hear what this report says. So I want to start by welcoming our speakers. So it's Erin Carruthers, the Executive Director of the State Council on Developmental Disabilities, SCDD. Vivian Haun, Senior Staff Attorney for Disability Rights California. Dr. Christine Moody, the Director of Research at UCLA Tarjan Center. And I think we have some others who are going to be, I don't know that they're going to be hosting, but I did want to introduce them because they might jump in and give some more information. William Liner, from the Managing Attorney from Disability Rights California. Sabrina Epstein, from the Policy Analyst from Disability Rights California. And Dr. Elizabeth Lageson from UCLA, and I'm not certain what the actual, is it from the Tarjan Center?
Yeah, it's the Tarjan Center. Well done, Christiana.
Thank you. Sorry about that. I kind of hiccuped at the end. So welcome all. Thank you so much. Christine, were you able to get the hosting so you can share your screen? Perfect.
Christiana, hi, this is Erin Carruthers, Executive Director of the State Council on Developmental Disabilities. Christiana, Judy, all of Disability Voices United, and everybody here on SDP Connect, thank you. Thank you so much for the opportunity to come here today. Had a good conversation, a needed conversation about a year ago when the evaluation began. It resulted in thoughtful, smart changes to the evaluation. Excited to explain what those are, and more importantly, excited to explain what did we hear from the community. This is the biggest, broadest conversation of self-determination program participants that's ever been undertaken to find out what are people's experiences in the program. We know it because we're living it. We know it because we're advocating from it. But when talking to as many people who are in the program, in a evaluation survey way of asking about the program, what did we learn? So really excited to explain to you and share with you all what did we learn. It went to the legislature on June 30th, as Christiana said. It has, you're the first group after that, we're the first group publicly that we're talking to. So really hope that reinforces your role, your advocacy, and your importance in the ongoing conversation about a program we all care about, we all love about, and we're all here to make better. I've already seen in the chat, and I got to tell that asking, can we get a copy of the report? Yes, as soon as it's ready publicly. What we're doing right now is we are interpreting the report, the executive summary, into plain language, into non-English languages, and making sure the report kind of looks better for a public release. Once that's available, yes, absolutely can share that. But what we have today is a PowerPoint to give highlights of the findings, the methods, the findings, and the recommendations to improve the program. So very proud. Christiana, thank you so much for introducing us. And with that, I'll share the screen. Thank you for whoever gave me access to share it. Sharing the screen and starting the slideshow. Hello again, everybody. Aaron Carruthers from the State Council on Developmental Disabilities. We're here to present to you highlights of the self-determination program evaluation. As Christiana rightly said, the law requires this report. And it says the report shall do, I mean, you have to do it, a couple things. Say whether or not self-determination program is furthering the principles that Christiana talked about. The evaluation also has to give recommendations to enhance the effectiveness of the program. The law says the report may, which means you don't have to do it, but we did, talk about people's satisfaction in the program, along with some other factors, including were your rights and choices respected? What were your experiences in accessing people to provide services in self-determination? So this evaluation does everything the law says and a whole lot more. So excited to get into that. The partners on this are, we're the federal partners. We're all funded by the Federal Administration on Community Living through funding from Congress. The State Council on Developmental Disabilities is the lead for this evaluation. The UCLA Tarjan Center, University of Excellence on Developmental Disabilities, led out in collecting and analyzing the data. And Disability Rights California was a collaborator in reviewing analysis and recommendations and writing. Also want to give acknowledgement to the University Center of Excellence in Developmental Disabilities at the UC Davis Mind Institute, who were early partners in designing the survey tool, and want to acknowledge the University of Southern California, their University Center in Excellence in Developmental Disabilities, as they came on as a reviewer of the product. So full complement of activities from the federal partners. All right, here's the drum roll, here's the big highlights, here's the findings. Yes, the self-determination program furthers the principles of the self-determination program we talked about. See Christiana's cheer, yay. That's a good finding because it means the program is delivering as it was designed in policy, as we all hoped it would. It is doing those things. Next, people who are experienced with the program largely view the program very favorably. Even more so, they'd recommend it to others. Even with the barriers that they're experiencing, there's some people who aren't happy in the program right now, yet they'd still recommend it to other people. That's really important. Other finding, the participants believe in the concepts. They believe in the principles. They know what the program's supposed to do. And because of that, it's driving them to stay in the program, to keep working through it, to deliver on the principles for a better experience for themselves. But they identify significant burdens. And those burdens are what we describe and summarize as administrative burdens. What work, busy work burdens does government create that gets put onto people who are trying to access government services? So there's a whole host in there. So there's the top line headlines. Want to give it over to Dr. Liz Lageson from UCLA and Dr. Christine Moody, who will then talk about the methods and go deeper into the results. There's a whole lot more in here.
All right. Well, thank you so much to Aaron Carruthers, our fearless leader in this project, for for giving a nice overview of what you can expect in this report. So, hi everyone, my name is Liz Lagus and I'm the director of the UCLA Tarjan Center, which is a university center for excellence in developmental disabilities. And I'm going to be sharing some of the background about the different phases of the self-determination program evaluation. I want to thank Judy, Christiana, Disability Voices United, and SDP Connect for the opportunity to share this program evaluation of the self-determination program. So we conducted our program evaluation in 3 phases to be able to get as many perspectives and different types of data, which I think allowed for a really, rich insights into the program. And in our first phase, we conducted a survey where participants rated their agreement, to certain statements, or were given options to choose for responding. And we're calling this phase the quantitative survey. It's phase 1 of this program evaluation. And in this phase, we had 242 respondents. Now, the survey that participants completed was done online, and it was based on the National Core Indicators, which was a requirement of this program evaluation. But truthfully, in all transparency, this phase was problematic initially because, as I mentioned to Judy, Mark, and other members of Disability Voices United in a previous meeting, that survey actually went live before it was supposed to. And it was still in the editing phase, and the language really hadn't been changed yet to reflect the uniqueness of the services that are specific to California. But rather than discount the voices of 242 participants who'd already completed the survey, we instead closed the survey and used aspects of the survey that were helpful in understanding the experiences of those in and outside of the self-determination program. So we were able to salvage the good parts of that survey and preserve those voices. So shortly after phase 1, we made some changes in leadership and on the project, and we were fortunate enough to enlist Dr. Christine Moody, who you'll be meeting in a moment, and some other partners at UCLA to lead the next 2 phases of the program evaluation. In phase 2, we conducted focus groups that were led by the UCLA Tarjan Center and Disability Rights California. And the purpose of these focus groups was really to understand the lived experiences of stakeholders, which included self-advocates, both in and outside of SDP, family members of participants in and outside of SDP, as well as independent facilitators. And so we conducted 9 virtual focus groups over Zoom, and we only had capacity for about 100 people in these focus groups, but many people wanted to participate. We got nearly 2,000 responses from people that really wanted to sign up for these focus groups. And it was so incredible, really, that we decided to open up the program evaluation to a 3rd phase, which was not a requirement of the evaluation. And so in phase 3, we created a qualitative survey where people could respond to the exact same open-ended questions from the virtual focus groups, but in a written format that was available online. And those responses were coded for the same themes in the same exact way that we coded the virtual focus groups. And so in phase 3, we received about 265 responses. So in total, you can see that we had 604 contacts with stakeholders. That's a lot, most of whom were enrolled in SDP. About 69% were enrolled. 31% were either not enrolled or had been enrolled, but were no longer enrolled. Also with a good representation of both caregivers and regional center clients who were reporting for themselves. About 53% of the participants were caregivers, about 41% were self-reports, and there were about 4% independent facilitators. So with that overview of our different phases of the program evaluation, I'm going to now hand it over to Dr. Christine Moody to share more about the program evaluation.
Hi, everyone. Thank you, Dr. Lageson, for that introduction and overview of our phases. I'm Dr. Christine Moody. I helped lead some of the data collection for phase 2 and phase 3, as well as the data analysis on the UCLA Tarjan side. And so I'm going to continue going through our demographics our sample, and then talk through the results in more depth. So here on this slide, you see a breakdown by diagnosis and age across our full sample. So across those 604 participants that we had contacts with. As you can see on the graph on the left, we had the highest number of autistic participants or family members who were representing autistic participants. We had the second most representation among regional center consumers with intellectual disability, that's ID standing there on the left, or caregivers representing those with intellectual disability at 28%. We also had representation of individuals and their caregivers and family members with epilepsy and with cerebral palsy, that's CP, and as well as those who qualified under the other condition in regional center eligibility. For age, our largest group was young adults, so those aged 18 to 30 years old, or caregivers representing a client that age. And then our second largest group was minors, so 0 to 17 years old, so 35% of our sample was minors. And then we did have representation of older, middle-aged and older adults as well, with 15%. Overall, just going back, overall, these numbers do closely mirror the general data provided by DDS on the self-determination program enrollment in general. So that was encouraging to see that generally these percentages match the overall enrollment. All right, so next we have our participants broken down by race, ethnicity. So we had a really diverse sample with particularly strong representation from the Black community. So you can see there 18% identified as Black or African American. We had 39% identified as white. We had 18% identify as Hispanic. We had 10% identify as Asian, and 15% identified in this other category, which includes individuals who identified as multiracial, as well as other types of race and ethnicity, including Middle Eastern, American Indian, Native Hawaiian, or other Pacific Islander. So here is a graph of our participants across, again, those 604 participants, which regional centers they were affiliated with. And we had all regional centers, all 21 regional centers represented in our data, with South Central, Lanterman, and Alta regional centers being the most prevalent. So moving into our results here, I'm going to go into some of those big picture takeaways that Aaron provided earlier. So first, we found wide support for the concept or the idea of the self-determination program. So individuals and families were really excited and hopeful about the idea of having more freedom in being able to design their programs and their services, being able to choose their providers. Really, people thought that this was a great idea and a great concept for the program. Our second bullet point there, we also found evidence that the self-determination program did actually further freedom and choice. So participants who enrolled in the program regularly reported enjoying the freedom of being able to choose their own providers and being able to use different types of services that were not always available in the traditional regional center system. Participants in the self-determination program were significantly more likely than participants in traditional services who were not enrolled in self-determination to report having supports that help them with their services and budgets. And they were also more likely to feel like their services allowed them to have a good life, which is really what we want in the end. Many connected the self-determination program and their enrollment in the self-determination program to positive growth and progress on individual goals in areas like self-awareness, responsibility, mental health, community integration, independence, employment, and in just overall quality of life and happiness. So that was really powerful to hear as well. So going to the next slide. So here we are. So following from those takeaways, we found that overall, in general, participants were satisfied with the self-determination program. On that quantitative survey, a majority of the respondents reported being satisfied and pleased with their experience, and a majority also recommended the program. In our qualitative data, so from those focus groups and from the open-ended survey responses, we also saw satisfaction as a frequent theme, and several participants went so far as to describe the program as life-changing. So despite all those positives, which there are a lot of positives, there were also a lot of challenges that were reported by our participants. The common themes or threads were that participants wished that the program was easier. It was more simple. They wanted it to be more simple, less time consuming. They found it to be very time consuming. They want the program to be easier to navigate, to have fewer steps or clearer steps. The most common theme in those focus groups and qualitative survey responses, what were these feelings of what we call administrative burden? Really that there's a lot of paperwork, there's a lot of steps, that it takes a lot of time, and that burden is on the clients and the families themselves. So another theme or kind of group of themes that was expressed were related to feeling like there wasn't enough support. So participants also really wanted more support. And the types of supports they were looking for, they included wanting access to more information or more clear information. They reported difficulties accessing that information about the program. They also reported that service coordinators sometimes were not well versed or didn't know a lot about the self-determination program, and that was a challenge that they faced in enrolling or continuing to navigate the program. And then also that sometimes staff capacity issues impacted their experience. So that would include things like service coordinator turnover, as well as wait lists, that there might not be enough FMS, financial management service agencies, and there's a wait list. And so that would be a capacity issue. And, things like not getting email responses back quickly, that would also fall into that theme of, wanting more support. Another area that was highlighted was a lack of availability of independent facilitators, who were highlighted as a source of support for many self-determination program participants. So moving to the next slide here. So our last kind of big takeaway that we're going to dive into before I show you some graphs and figures is that focus group and qualitative survey participants reported on several different forms of inequities within the program, including racial disparities and disparities in how the self-determination program is being implemented across different regional centers. So in particular, independent facilitators that we talked to were able to speak to this because they have experience across multiple clients. And they were able to, they shared concerns about differences in what types of services or line items are approved in the budgets, as well as differences in the total amount of the budget. Participants also shared that due to that high level of administrative burden, so all the paperwork and the steps, that the program would not be readily accessible to individuals with disabilities themselves who may not have a strong support network, participants for whom English is not their first language, as well as families with varying socioeconomic and educational backgrounds, families that maybe are working multiple jobs and don't have time to kind of follow up or call and be on hold for an hour. So those things came up in our qualitative phases. And then we also found in our statistical analyses significant differences in certain groups. So for people of color, we found that, and we're labeling BIPOC participants, so Black, Indigenous, and people of color as a group as compared to white participants. So BIPOC participants were less likely to report having met their service coordinator, and were also less likely to describe receiving support from regional center staff in their open-ended responses. BIPOC participants also reported significantly lower levels of satisfaction with the program on that quantitative survey in phase 1. One positive finding, though, on the qualitative survey, BIPOC participants were more likely to describe those examples of achieving successful outcomes and goals and progress through the self-determination program than their white counterparts. We also found evidence that the self-determination program might be harder to navigate for younger participants and their families, so under 18, as well as for autistic participants. Both of these groups were more likely to describe multiple types of challenges and barriers in those qualitative survey responses. We also found on that in the phase 1 quantitative survey that participants or family members representing participants under 21 were less likely to recommend the program than participants and family members associated with clients over 21. And then autistic participants were also slightly less likely to narrate in their responses being satisfied with the program too. So moving to some of our figures next. So just these kind of go into some of what I've already described, but this just, is a graph showing our results from the quantitative survey in response to a statement about satisfaction. So the statement is, I am pleased with my overall experience in the self-determination program. And the majority of participants, so 69.9% expressed some level of positive agreement. So 39% strongly agreed with that, and just about 31 endorsed somewhat agree. In our next slide, we have a breakdown of the responses to the question, I would recommend the self-determination program. And actually this number is even higher. So the majority, 77%, expressed some level of positive agreement that they would recommend the program. So 57% said strongly agree and 20% said somewhat agree. So next, this slide, and I know that the font might be small, but this is from the focus groups, and this shows the most frequently coded themes of helpful aspects or positive pieces that came from the self-determination program. So the top 3 I've already talked about here. So support for the principles of self-determination. So that's that support for the concept, the idea of the program. And then the next one, freedom and authority to choose services and support. So we had 44 different examples from the qualitative survey where people were describing that they had increased freedom and increased authority from the program. And the next big chunk here is overall satisfaction with the self-determination program. So we had 44 examples from our coded focus groups as well that highlighted that. So in terms of some of the other themes that were prevalent here, we saw that participants in the program found sources of information outside of the regional center helpful. That's the next triangle there towards the bottom. And this includes kind of talking to other families, social media groups, information from advocacy groups. With respect to services, participants reported that the self-determination program gave them better service access, more individualized or tailored services to their needs, and also they highlighted the ability to pay their service providers better rates. Other codes included when participants really expressed appreciation for when regional center staff, FMS staff, and independent facilitators were supportive throughout the process. So this wheel, the yellow wheel, shows the most frequently coded barriers and challenges from our focus groups. So as we've discussed, that administrative burden, the amount of paperwork, the amount of steps that a client or family has to go through was really the most commonly coded barrier and challenge. We also saw lack of information, inequities, challenges with staff capacity, like I've talked about, and lack of staff training and knowledge as interfering with the success of the program. Other barriers and challenges that were discussed included highlighting kind of specific flaws within the self-determination program policies or systems, things like the financial management service policies limiting the ability to pay for services in advance. That was really seen as a challenge, or that there weren't standard timelines for the enrollment process across all regional centers. That was another flaw that was identified. Participants were also frustrated when regional center denied services or budget items. They felt like their freedom and authority was limited, or that they didn't have that sense of freedom. Many experienced significant delays in enrolling, which led to gaps in services. And even once in the program, sometimes there were delays due to processing, payment, that led to gaps in services or missing out on services. Though less common, we did see that some participants felt there was resistance to the self-determination program from within regional center, with service coordinators sometimes discouraging enrollment or not kind of facilitating that enrollment. So with that, I'm going to pass it to Disability Rights California to go into our recommendations.
Thanks so much, Christine, and good evening, everyone. Thank you for having us with you tonight. I want to start by saying that if you are a regular attendee or even a semi-regular attendee to SDP Connect's, I don't think that any of the findings that we just presented to you should come as a huge surprise. Hopefully, as you were listening to them, you were nodding, or maybe you had some questions. You wanted maybe further clarification or to dive into it, but hopefully none of this was news to you because you've lived it. And I know that at many SDP Connects, many of you have brought up or talked about a lot of the issues that we've just covered today. So I certainly want to acknowledge that, and hopefully it validates many of the things that you have been seeing from very early on. So, and now that we've taken a look at the findings, what are some of the things we can do in response to those findings? The report does contain a number of recommendations, and we'll start with the first bullet point here, which is to think about ways to improve access to information about self-determination, because something that again came up again and again was the sense of how difficult it was, how confusing it was to get straightforward, accurate, really just user-friendly information about even the most basic elements of the program. What is it? Like, why is it different from the traditional system? Why do we have it? Why might it make sense for me to consider it? What are the types of situations or individual circumstances, right, that self-determination might be good for? All the really elementary things that people might have questions about at the very beginning. I think people frequently felt like they didn't have a really easy way to access those answers. I think there was also disappointment and some frustration with regard to service coordinators not necessarily having the level of expertise or having all the right answers that people were hoping to find from them. And just the sense that it would be a lot more helpful to have something more centralized and easier to access. So we have recommendations along those lines. The next two bullet points are very similar and related, but they have to do with something that I know many of you have experienced yourselves. And that is a need to streamline some of the really key processes that are necessary for people to even get started in self-determination. In particular, those include the enrollment process. So all the steps that you need, all the hoops you need to jump through to even get started in earnest. And then even within that, there is the process of calculating time when it's your initial budget. But coming from a family where my brother is now in his third or fourth year in self-determination, I can report that that continues to be a challenge even after the initial year. Coming up with the right budget amount can be difficult, especially when different regional centers each seem to have their own individual way of approaching how they calculate the budget and what they use to determine it. And especially how they approach things like unmet need or change in circumstances. While the statute is clear about the kinds of things that can augment a budget, different regional centers have each interpreted in their own way or implemented in their own way how they go about making that real. So streamlining, standardizing, and just really simplifying those processes is another one of the report's recommendations. We've mentioned many times already how one of the recurring themes is to reduce the amount of administrative burden and complexity, just looking for ways, opportunities to balance some very real requirements and needs that we just can't get around as a system because of federal law and regulations, some state law and regulations, but still looking to find ways, well, where can we boil things down? Where can we maybe combine things? Looking for more of those opportunities and maybe shifting our mindsets as a system from finding ways to make things possible and easier and having that be more of a priority. And then lastly, before I turn it back over to Erin, I'll talk about improving the compensation and capacity of independent facilitators. And this is one of our recommendations because, as many of you know, independent facilitators are so critical. And so many people identified IFs as being really, really essential to helping them get into self-determination and helping them through self-determination. So the sense that people did not have adequate access to IFs, that there weren't enough IFs, or there weren't enough really good IFs in our area, IFs that spoke your language or were culturally competent or were used to dealing with people with your particular needs or set of circumstances. All of those things were reasons why one of the report's recommendations was to take another look at how independent facilitators are compensated, making sure that that is adequate so that IFs are adequately paid for the really significant and often complex and creative work that they do to support people. And when we're talking about capacity and improving the capacity of IFs, we're talking not just about their skill set and their abilities, although we certainly talk about that too. We're also talking about the system-wide capacity, right? Well, we were just talking about the adequacy. Are there enough? Are there enough people who have the skill sets that we need? And I know that DDS has recently come out with a set of directives that have sort of changed over time how IFs are being compensated and the kinds of work that they do and the steps that they need to go through to help people get into self-determination. And we might suggest that that be things we might want to revisit to make sure that there's the right balance between ensuring skill and quality in IFs and also just making sure we have enough. And with that, I will turn the rest of the slide over to Aaron.
Thank you so much, Vivian. And Vivian, I want to echo something you said, which is that these recommendations probably aren't going to sound new to you. But I think what should be really important and what should feel good is that these recommendations come directly from the evaluation. They come directly from the voices of the people who participated in the survey. So every single recommendation here, we can link it back to what people said in taking the survey. Now, if you were somebody who took the survey, thank you. You can see your voices represented here. But for those who didn't, you can still see that your experiences are being shared by others. Their voices are coming through, and we're really proud to amplify them, echo them, and make sure everybody hears them as to what's going well and what needs to improve. I call the self-determination program the soft revolution, or the quiet revolution, because it is transforming the way services are provided. And it should, because the community needs it, but the system sort of needed a mechanism, some way to kind of get there. And the next recommendation gets to that. The recommendation is to use the self-determination program as a way to improve workforce hiring and workforce retention. As Dr. Moody said, one thing people really like about the program is I get to hire who I want. I get to hire who I like. That matters. And that matters in fundamental ways that we all know, but when it individually in our lives, but when it happens across the system, it ends up transforming the whole system. And it transforms it in multiple ways. First of all, related to enough people to do the jobs, enough workforce. We know and we see and we hear there is a crisis in direct service providers. There being enough people. But when we find, like in self-determination, it's often people who we know, who are in our families, who are in our neighborhoods, who we bring in to say, hey, I've got this need and I can pay you. You want to do it. It actually ends up being a way to bring in more workforce. Typically, when we bring in more workforce that way, that workforce, looks, acts, has the same cultural understandings, beliefs, and values of the person who's hiring them. So you automatically start addressing the racial and cultural gaps and disparities that exist throughout the system. So using what self-determination does as a way, as a model to impact the rest of the system through the workforce hiring, the workforce retention. That's one of the recommendations. The last recommendation is just create a more equitable system. When we hear very clearly and can statistically lay out the difference between Black, BIPOC self-determination participants and white self-determination participants to say, I'm not getting the same supports. I'm pretty unsatisfied with the program, but I'm getting better outcomes. That's significant, and that has to be addressed. We can't make the burden so high and the barriers so high and the responsiveness so low that Black, Indigenous, and people of color are not participating in the program, even though they're more satisfied with it and what they get out of it if they go through the work. Got to remove the work so people can get the benefits without the burdens. So the recommendations in creating a more equitable system looks at every single recommendation above and finds ways to introduce equity into those other recommendations. So With that, I want to say thank you. I want to turn the meeting back over to you, Christiana, and to all the participants here for a discussion.
Well, I'm not sure if you noticed, but the chat has been very, very active. So we're going to have lots of questions. I want people to know that you can either put your question in the chat or you can raise your hand, and we kind of alternate between the two. I did want to say that, you know, we had concerns at the beginning, at the onset, as you talked about, but the final report has represented what we're hearing anecdotally. You know, what the people we hear week after week at SDP Connect, that we think that you did represent the good news of, you know, and warmed my heart and made me so excited to hear that it is promoting those principles, because that's mainly why we're here. And so I was very happy that it is doing that, and you were able to show that. And it also shows us we've got some work to do. We've got a lot of work to do. Judy, did you want to make any comments before we get to questions?
Yeah, and just thank you all for joining us. We really appreciate the partnership with you on getting these results out. You know, as we met a couple of weeks ago, and really look forward to working with you on getting some of these recommendations instituted, because that's the key here, is that people love the self-determination program in its ideal form, but in reality, it's got a lot of barriers and problems. And we need to work together, and looking forward to partnering with all of you on breaking down those barriers in the next year. So I just want to, I've been going back and forth behind the scenes administratively, and just to let folks know that when you're called upon by Christiana, you will be able to, you'll be made a co-host, and you can turn on your camera if you like. We are keeping the cameras off for now because of potential spammers or Zoom bombers. But since so far everybody raising their hands are our friends, we are more than happy to let you turn on your camera.
Howard, how are you? Are you able to unmute? Here we go.
Howard, you should be able to unmute and turn on your camera if you would like.
Thanks, Ed.
Why don't you move on to Connie? He might have walked
stepped away. Connie, would you like to unmute?
Yes, hi, this is Connie. Thank you for the valuable report. I sit on an SDAC committee, and like all of the SDAC committees, we've been tasked with given funding to improve the SDP program. I'm wondering, you know, these were great recommendations, but in terms of actual specifics, what we can use to, let's say, decrease disparities, what would that look like? Do we have any actual specifics on how we can utilize this money to improve things? Even IF salaries or whatever it is. That was my first question. Are there any recommendations specifically on how we can address this? So that, because we have to put what program, you know, where the money's going to go to improve the objective.
That's a great question. Does anybody on the panel want to jump in, or?
Hi, Christiana, this is Aaron. I raised my hand and I took off the microphone. If there's a different way that works, let me know. But Connie, I think it's a great question. And the amount that each local SDAC it's important, and it should be targeted to your local needs and what you need. And this is my values, just my opinion. The problems of disparities throughout the system are in the entire system. I don't think there's an amount that the local advisory committee can spend that's going to address something that's happening throughout the system. So I think the solutions need to be broader and bigger than what one individual local advisory committee can do. I think it would be, I think one of the recommendations, I don't know if this was just in my head or if it actually made in the report, I got to flip back through it again, but for DDS's service access and disparities grants, one idea is that they actually target and set aside money specifically for reducing disparities within the self-determination program. So those are dollars that are set aside to be targeted equity funded initiatives. Set those aside for self-determination.
That makes sense. That my other question is what I see from this report is because each regional center does things differently, that in itself is a barrier in terms of operations, in terms of IFs, because maybe the IF is working for 3 different regional centers. And so they have to learn 3 different, rules. I guess I'm questioning, why isn't there more standardization among the regional centers? Because to me, that would make more sense. It would be more efficient. We could get more staff that way as far as IFs, for example. So that's another question.
Connie, you are singing our song. That has been a question that has, I think, been in the air and has been talked about for the last several months, especially from the bottom up, from the grassroots level by people, and also from the very top by legislators and legislative staff. That has been a question, and it's something that we at DRC have raised as well. I think the consensus of most people in the
Shoot, it froze.
Statewide, local control has gotten really imbalanced, very much out of whack. I think a short, probably oversimplified answer to your question is that the regional center system, as its name implies, was set up in the late 60s from the beginning to be really about local control and to be very driven by local community concerns, which makes sense and sounds good on paper, right? That locally run organizations are the ones who know the needs of the local community best, right? But over time and over many decades, and as government has expanded and lots of things have changed, I think more and more we've now seen more and more of the downsides when regional centers have a lot of discretion and a lot of ability to set their own policies, do things their own way. I don't think that that means that we necessarily want everything to be done in the exact same way by all regional centers in every instance. We want regional centers to be able to experiment and try different things in certain ways that I think many of us agree with you, Connie, that there are just certain bedrock things that are too important to be done differently, and that they're just essential. They're things that we have rights to, and standardization of some of those core principles, I think would be a great start to make sure that whatever regional centers do, those things are grounded in racial equity.
And to back up Vivian, this is Aaron again, to back up Vivian, the recommendation contains that report and also states, don't do it in a way that removes individual choice and liberty and freedom. So don't make things so standard that the program just becomes meaningless because it's just a plug and play of everything else. So but standardize the parts that don't have to be recreated. There's no reason, each regional center has to make their own version of everything. Make those parts standards, but preserve and protect the parts that keep individual choice and freedom and flexibility.
And when we talk about standardization, it doesn't necessarily have to be the direct opposite of individualization, although it can seem like that on the surface. What I think would be helpful to standardize is a common set of questions and factors that regional centers should take into consideration. A common consensus of what's really important to make sure that there's a comprehensive approach. So if you're talking to a service coordinator, right, they have almost like a checklist. They have a list that they're referring to make sure that what they are asking and the things that they are thinking about are comprehensive and take into account the things that really matter and make a difference to people. So what we're standardizing is an approach to make sure that it's comprehensive enough for it to be truly individualized, if that makes sense. Because if we don't, and we just leave it up to whoever, individual regional centers, individual service coordinators, that's when things are not comprehensive and things get left out.
I personally would like to see standardized timelines. That seems like something that would not take away people's freedoms, but could improve everybody's. So that's just me. Howard was able to unmute and we see him.
Can you hear me now?
We can hear you now, Howard. How are you?
Okay, I finally managed to unmute. And first of all, I want to say, welcome home, Judy Mark, from your trip in Europe. And I hope you had a good time there. And I also want to say that I very much want to help Disability Voices United work on AB 1147, getting that bill passed. I am very willing to go and meet with state legislator and anyone else who you might want me to talk to help lobby and agitate for this bill, because I think that would be a very important part of a solution that we've been talking about here to the problems of lack of standardization and disparities and so forth. I think AB 1147 is a very important part of that, and we need to work hard for it, and I am absolutely at your disposal. And finally, I want to ask one question. If the requirement for independent facilitator to be vendor, does that apply only to people with just started self-determination in this year, or does it apply retroactively? I was the first person to be given self-determination in my regions in Atlanta. So is that retroactive, or does it apply only to people who started this year?
Howard, that's a great question. So it's only going to affect the people who are transitioning in now. Once you're in the program, the ongoing, you can hire whoever you want to be your independent facilitator. That vendorization will have no impact on you at all. So it's
that's what I thought. But that's an important question for me, because my independent facilitator is now in Sacramento. And, you know, if she's living in Sacramento, she might find it difficult to get vendor with the Rantaman region, which is here in downtown Los Angeles. So that's all I had to say. And again, I am at your disposal for AB 1147.
Thanks, Howard. You know we're going to call on you to help.
Okay, I am here for you.
Awesome. Ed, would you like to read a couple questions from chat? And then we'll get back to hands up.
Sure. Let me look at a couple of these. There are a lot of really great questions in chat. And folks, as usual, I just want to let you know, if multiple people ask similar questions, I do tend to summarize and ask them in one. So Beth asks, how do the participant numbers in this study compare to total participants? Are there really that many fewer adults in the over 31 group?
That is a great question. And I'm going to see if I can pull up the DDS published data on the enrollment in the self-determination program. Our numbers were broadly similar. And so I do think that the middle-aged older adults would be the lowest represented group. But I'm going to see if I can get the exact numbers here for you.
And while we had less control over who was completing the online surveys, when we chose our focus group participants, we were very intentional in trying to represent DDS and the consumers that we were representing in this report. So Christine can speak to that as well, but that was very intentional for the focus groups where we actually did have choice.
Yeah, we had everyone in the focus groups complete a pre-enrollment survey where they selected or shared information about their age, diagnosis, race, and gender. And so we were able to intentionally select from those who signed up that which would match or as closely as possible mirror the overall representation within DDS. And so that's how we selected. Of course, sometimes, when we're balancing multiple demographic characteristics, like I said, race, age, diagnosis, region was another one. We wanted to make sure we had people from across California, gender. It was hard to kind of get the perfect match, but we did our best. And thank you, Aaron for pulling this up.
So Christine, I just wanted to show that the DDS groups their ages differently. So they have everybody from 18 to 64, which is typical grouping, but in that it blends what to do is to show such a difference over 31.
So I do want to give a shout out to our Connect listeners because they showed up. They came out and they did the surveys and all of that. And I don't think that that's that usual. I think sometimes it's hard to get people to come out and answer the surveys. And so, awesome to you guys. Thank you for showing up and answering them and giving your opinions because it really is helpful. Ed, do you want to do one more chat question?
Certainly. So our next question is from, let me scroll down here, is from Lourdes. If regional center clients are about 40% Hispanic, how significant is it that only 18% of those clients were Hispanic in the survey? Can we conclude that there is a language barrier?
I'm wondering, Aaron, whether you would be able to share that that same DDS data, because I think they also have it broken down by ethnicity and race. Again, and so it'd be really interesting to just confirm or to confirm that the self-determination program overall enrollment is lower than, you're right, 40% across the state of California too is the Hispanic percentage, and potentially definitely could be a language barrier. That was one of the inequities that was highlighted in our qualitative survey respondents, that it would not be accessible to people whose first language was not English.
So Christina, I pulled up the information, and what I'm pulling from is a PowerPoint that Department of Developmental Services presented to the statewide self-determination advisory committee meeting in June. Their race and ethnicity breakout is, it again doesn't line up because it's broken out by age. So this is for people who are 0 to 3 to 17 years old, and then 18 to 64 years old, and then over 65 years old. But if there's a particular slide you want me to land on, just direct me through it and I'll.
If you could stay on the adults, so you can see whoever asked the question is totally right on point in that there is a lower representation of Hispanic participants in the self-determination program overall, 20% of self-determination program participants as compared to 37 in the regional center for adults. And so our data is well aligned. We had 18% in our program evaluation across the 604 identified as Hispanic or Latinx. And so that's pretty close to that 20% that is seen here for Hispanic. But definitely, I think it does highlight potentially barriers to enrollment for Latinx and Hispanic families, potentially related to language.
I could also add too, I mean, although we were very intentional in trying to mirror the demographics of DDS, we also were very intentional in our attempts to oversample Hispanic and Spanish-speaking families, Spanish-speaking in particular, because we know that they're often underrepresented. And the way that we tried to do that was by providing the focus groups in Spanish, and also having Spanish interpretation and Spanish captioning in all of our focus groups. So, it was definitely on our mind. And I think that, in the end, we did mirror the state demographics with DDS, but I think there's a lot of work to be done there. And I think that we are missing a huge proportion of people that could really benefit from this program and from these services.
One of the recommendations too is areas for future research. So when you do when you do research, it tells you things that you really kind of want to know more about. For example, we recommended do research on service coordinator views, beliefs, and attitudes. You know, that came forward from people who participated in this survey. That's important enough to spend time and money to learn more about. Another recommendation was do a focused research on Black, Indigenous, people of color who are in the self-determination program. There was a robust response in this survey, but this survey revealed enough to say, let's spend money, let's spend time, let's spend focus to learn more about experiences among people of color, and also specifically about the barriers.
I think it goes back to the question about the committees too, the self-determination advisory committees, and what they can do, and talking about that with the committees. I know that they are tasked with, one of the things that they're tasked with when they're given the money is to work on disparity, and how to do that is the key question, right? And I don't think we have that answer yet. And I think we're all working on figuring that out. Linda, would you like to unmute? Give it a, oh, there we go.
Thank you. Oh, wait. Hi. I had a thank you so much for all the work that this group has done in terms of putting together the report and all the research and data crunching that you've done. I had two questions about impact that were not mentioned, and I don't know if that's because it was not under the purveyance of this particular evaluation, but when you did the report to the legislature, did you evaluate the fiscal impact of the self-determination program at all? I know eventually it's supposed to be cost neutral, and so I was wondering about that. And also, one of the key components of the self-determination program is local volunteer advisory committees. And I don't know if the effectiveness or non-effectiveness of committees were addressed in their surveys, and whether there seems to be a need for some consistency between advisory committees.
Linda, those are really good questions. With regard to the fiscal impact, the report really did not get into that. This report was very much focused on the experiences of people in self-determination, right? Because those are central. And that's really kind of that was the extent and the scope of this study. But what you're bringing up is, of course, incredibly important, because we all know kind of at a high level and in the big picture, that's such an important issue to ensure the longevity and sustainability of self-determination. And that was just beyond the scope of what this particular report was looking at, but that's not to say that it doesn't need to be looked at, or that it's, it shouldn't be focused on in whatever the next round might be. Budget neutrality is incredibly important. And it's interesting because I have seen, I think just in the last couple of weeks, I was really pleased to see articles in some in Health Affairs talking about the budget neutrality requirement that Medicaid has and calling for that to be rethought. Because if, as a federal system, one of the things you're doing is saying, okay, yeah, you can do all this fun, cool, innovative stuff, but it cannot cost a penny more than it otherwise would have, that seems to pose some equity issues, right? That puts a real limit on what you can do. And I see a new waiver. Washington just had a new waiver approved, I think, this week, And they're one of the states where they've been able to play a little bit. They still have a budget neutrality requirement, but because of the way they've set up their waiver, they've been able to play around a little bit with how strict that requirement is. So I like where you're headed with that question. All I'm saying is that unfortunately, there's a lot more there to get into, but it's not here in this report. And I'm sorry, what was your second question?
Whether the effectiveness of the local advisory committees was addressed in some of the feedback in the surveys, or the
Liz or Christine, do you recall, or do you want to speak to how much that was brought up in the feedback?
We did hear in our qualitative phases, so the focus groups as well as the qualitative survey, many themes related. We kind of grouped them together related to those supports outside of regional centers. So that included advocacy organizations, and then we also supports within regional centers. So that included the self-determination advisory committees. And so, or that's where we put them. So that did come up. Sometimes I think that it was within that group of, or that theme of regional center related supports. We had the most common was some examples of participants feeling like their service coordinator was really supportive and helped advocate or help walk them through the process. But we definitely also heard from some families and participants that they attended or were able to get information from the self-determination advisory committees, as well as from ombuds persons at the regional centers. So it did come up. I would say it wasn't definitely was acknowledged by some participants. Yeah.
It would help if I unmuted. Lisa, would you like to unmute?
Hello, thanks for this platform and letting me speak. And I have one comment and one question. And as far as I know that Vivian talked about the standardizing at high level, and I truly agree that that is very necessary for the grassroots level, because it's SDP can be successful. It depends on the regional center coordinator and the supervisor. If you do not have a supportive service coordinator and the supervisor, the SDP cannot be, it will look different. So if you have service coordinator and supervisor who are passive, and then the SDP case could be going to the regional center legal team for it to move forward with the SDP process. So I think it's very important that we have the somewhat structure organization when the SDP go into first initial SDP process, just like what is the how long should SDP process take? Up to now, we don't know that. Some people, it'll take a whole year. Some people, it'll take 3 months. It depends on how hard the SDP coordinator and the supervisor willing to put in a time for the client. And then as far as the race and equity and the ethnicity funding goes, is this representing all race and ethnicity? And are we not putting any limit to which race and ethnicity that each region is representing? Because I'm an Asian and I live in Central California, and majority of time there's no representation, even with the DDS. when I talk about, well, what about that 2% of 2% of the race and ethnicity group, and DDS told me that at this time we don't have that representation. We're only representing majority, not minority. So I think this is very important. We don't put the limit, and then we'll represent the all race and ethnicity.
I think Erin wants to respond to that.
Oh, thank you so much, Christiana. I actually had my hand up for different reasons, but so I don't want to distract from the very good question. But if you come back to it.
I'm not sure there was a question in there, but there were very, very good comments, Lisa. I think that, did I miss one? Vivian, did you have something you wanted to? Okay.
Well, you mentioned limits in your comment, and I really hope that you're that we are not referring to any like official or formal like hard limits to the number of people who can be enrolled in self-determination by race or ethnicity. I don't think that those exist, and I don't think that even with all the problems in the system, I don't think that that's an explicit intention of anyone in the regional center system or at DDS. However, I completely understand how it could feel like, right, a very official limit to the number of people of color or from different backgrounds who can, just as a matter of practice, actually participate in self-determination because of so many of the barriers that we have been talking about today. It just, again, it goes without saying, so many of the existing inequities in the traditional system and the barriers and the reasons for that just get replicated, unfortunately, in the self-determination program, whether we're talking about, and they get replicated, right? When we're talking about things like adequately determining someone's need and how that reflects in someone's budget, listening to the role that local voice and the voice of just local community members. How much do regional centers actually meaningfully listen to and incorporate and actually center and co-create with people on a local basis instead of just using local groups as audiences, right, for information that they want to give to them? Those are the things that I think we've heard from many people, that regional centers don't do well generally, or people feel like they don't always do that well generally. And so the effect of that just gets intensified in self-determination. And then there are some really specific things that don't exist in traditional system that I think can also act as a limit, or, even if it's not an official limit. I will say that culturally and linguistically, the term is network adequacy, which is just a fancy way of saying the question of, do we have enough providers, regional center staff to meet the demand, to provide what people actually need, which are people who get where they're coming from, who know their communities, and ideally come from the same communities and have some similar lived experience. And for whatever reason, that does not seem to have ever been a driving priority behind DDS's initiatives to really dig into how adequate are our providers and people who know self-determination, especially. And if they're not adequate, what do we need to do? Like, where are the biggest gaps, and what do we need to do to ensure that adequacy? It's just not something that has been a focus yet.
So I'm going to chime in here only because we only have 5 more minutes and there's a lot of people's hands raised. And I know that people want to make a comment. So I'm wondering if we can go through very quickly these folks. If you could all just keep your comments to a minute each, and so that we can just take their comments. And can we start with Connie?
Hey, Judy, could I address
real quick
the term Latinx? It was used today, and I see the chat and really the reaction and the response back to it. I want to highlight Carmen's comments. Carmen, you're right on. You're saying you're asking for respect from the Hispanic community for people who don't identify with Latinx and reject that term. I really want to acknowledge all of that. Also, and just apologize. There was no offense meant. There's no disrespect meant. But I also hear that disrespect was felt. So I want to acknowledge that. Say thank you for raising it. I don't know when and how it came up, but glad to step forward and just say thank you for raising it and apologies. No disrespect meant.
Thank you, Aaron. Appreciate that. Connie, can you go ahead and unmute? Go ahead. 1 minute, please.
Okay, it's Harvey.
Harvey, go ahead, Harv.
Okay, this whole thing breaks my heart with all my soul. It does.
The
And
barrier.
I thank the barriers. DVU, you're doing it, you're trying. Bottom line, solutions. Best place is in the country for self-determination. Separate it out. It's conflicted. It always will be conflicted. It's a fight between management, my safety. This is about people with developmental disabilities. This has happened in other states. Separate it out. The most successful places in the country. The state runs it, but it's separated out from the traditional system. It does break my heart, and I'm telling you that because it can be done. Thank you, DVU.
Thank you, Harv. Let's go to Rick Wood next. Go ahead, Rick.
Quick question to the panel. Can anybody provide sort of a 30-second or 1-minute summary of the reaction of the department when the report was presented to them a week or two ago?
Hi, this is Aaron. Sure, lots of questions about the data, the methodology, trying to understand how are the numbers put together, what significance do they carry in statistical terms, and a thank you, saying they're going to take a closer look at the information.
Yeah, I would echo that. I think that they were actually very interested in the methodology and what the numbers meant and really respected the data and said so. And we're really going to take the data and really look at it a little bit more closely. But as a psychologist, I could say I did not feel a defensiveness. I felt like they were pretty open to hearing the report. And I actually don't think that it was any big surprise on their side either. I think this report really reflects the voices of the community, and I think that DDS is aware of those voices.
Thank you.
Thanks, Liz.
And just to clarify, if people didn't understand, when Rick said department, he meant Department of Developmental Services, DDS.
Thanks, Christiana. Just a heads up, if I could get a thumbs up, if it's okay, from Helen, our Korean interpreter, that we're going to run about 5 minutes long. Is that okay with you? Thanks, Helen. We just want to make sure that people's questions are asked. Valerio, go ahead. You can ask your question.
Buenas tardes a todos. Yo lo único que quiero, bueno, dos cosas. Primero, yo pienso que el DDS debería de no obligar a los, ¿cómo se dice? Facilitadores independientes a vendorizarse con centros regionales. Eso va a poner más barreras para los que nos estamos tratando de inscribir en autodeterminación. Yo pienso que el DDS necesita hacer algo al respecto. Otra de las cosas es que empezaron a usar el término Latinx otra vez, y ya en muchas otras reuniones la comunidad latina les hemos pedido, expresado nuestro descontento al respecto, porque en mi opinión la X significa un 0 a la izquierda. Entonces estamos viendo que para los que rigen o hacen las reglas, nuestra comunidad no cuenta, y eso no está bien. Nosotros respetamos a todas las etnicidades y pedimos el mismo respeto para nuestra comunidad latina. Por favor, eviten usar el término Latinx. Por favor. Gracias.
Thank you so much, Valerio. And I can tell you at DVU, that is our policy. We use Latino, Latina, if it's all women, because we listen to the community, and I hear you, that's what you want. Fernando, go ahead. Can you make Fernando a co-host so he can unmute? Ed, please. Fernando, okay, there you go, Fernando.
It wasn't letting me unmute. Thank you. I'm echoing a little bit on what Valerio was talking about in regards to the term Latinx. I believe that we've had this conversation numerous times. Unfortunately, there are people who still are insensitive to that, but it really talks to the bigger picture. When we're talking about the issues and the barriers that this whole meeting has conversed on in regards to this new program, it is imperative that we maintain sensitive to this type of discussion and start implementing those elements and using Latinx as an example that I think is some of the elements that are creating these barriers or that is creating the challenges in implementing this new program. So I don't know what it's going to take, and I know that some people are rolling their eyes and saying, well, geez, you know, Latinx is something that I embrace, I relate to, and so forth, and that's okay, because everyone's entitled to their own individual perspective. But when you hear it from such a large group of individuals that you're supposed to be working and engaging with, then something or another has kind of disconnected, and maybe need to go back and look at where in that disconnection is, and how maybe a conversation with individuals to better understand and figure out how do we embrace it. But Latinx is an example, but I'm sure there are a multitude of other elements similar to that cause the disconnect. So thank you.
Yeah, you might, I'll suggest one, Fernando, and that's the BIPOC term. Honestly, it's not a community-oriented term in many communities. They don't even know what it stands for. So we try to be really careful in the language that we use when we're talking to the grassroots. So just a suggestion.
Just to add to my comment, and for the record, Aaron, I did not hear you use that word at all. And I know you've been sensitive to that, and I appreciate you addressing that. I just wanted to kind of make sure that was clear. Thank you.
So there are many other questions related to the self-determination program in the chat. And I know that there's some new concerns that just came up today as GT Independence held its first webinar about their significant increase in their employer burden rates, which is going to be a very huge problem for about 60% of the people in the self-determination program in the state. We promise, we commit to you that we are here every 2 weeks and that we are going to cover these issues. We may need, in fact, Christiana, to have an entire session on employer burden rates, because it's becoming such a huge barrier to people's participation. So we promise we'll do that. We went a little bit long today to make sure folks had their questions. And so I'll let you take it away, Christiana, to close it up.
We just want to thank everybody for coming. Thank you all for presenting. That was a lot to present. It was a lot for us to understand, and you did a great job explaining it all to us. And we will see everybody in 2 weeks, where we're going to be talking about EVV, but we will also get back to, we can answer any of the questions that we didn't get to today. So we'll see everyone in 2 weeks. Thank you.
Thanks, everybody.